I do otolaryngology, head and neck surgery, which is basically the specialty that deals with the head and neck aside from neurosurgery and ophthalmology. I have a subspecialty focus in rhinology, which is nasal and sinus disorders. I treat people with nasal and sinus symptoms, and the majority of my time I spend treating people with chronic sinusitis. Basically, a lot of what I deal with is quality of life issues. People have symptoms. It's not typically life and death because I don't do much oncology. So dealing with people is figuring out what's bothering them, trying to figure out if it is something that I can help with, and then trying to offer them different therapies, whatever, be it medical or surgical, to try and help that problem. The majority of what I would do is called endoscopic sinus surgery, which is using telescopes, endoscopic, and sinus surgery. So then we'll do sort of, you could break it down into its little subcomponents, but the big term used best to describe it is endoscopic sinus surgery. Typical day is quite varied, actually, which is kind of why I like this.
Yes.
So like today I do clinic. In a typical week I'll do 2 days of clinic a week, which is often more than many surgical specialists. And because we're managing the problems from a medical perspective in the clinic, and then identifying people who may need or benefit from surgery. I'll do usually about 2 to 2.5 days a week of surgery, and then a day to a half a day of academic stuff, administrative or teaching. I would say there's many aspects of it that I like. I mean, if we're talking about the clinical side of it, it's having people come back and either feel or look better, like I've made a difference. So it was a good afternoon today. I had a guy come back who was just over the moon because he was so happy, and he's had multiple previous surgeries, so I did a revision and it went really well, and he didn't have any pain, and he was just delighted by the whole thing. So of course that makes you feel good. We got a talk one day from a head and neck surgeon and just I was like, wow, that's really cool. And so I spent some time talking to him, and he was very welcoming about it, and so I did an elective, and one thing led to another. Here I am. People assume that nose and sinuses are kind of just my sinuses. It's like, well, they often don't distinguish between a nasal symptom and sinuses because they are contiguous but different. Nasal stuff is typically nasal obstruction, or I can't breathe through my nose, or I have drainage from my nose, whereas sinus-related stuff is more pressure. It's a little more vague, and it's sort of this kind of thing. When they do that, it's sinuses. When they say I can't breathe through my nose, it's nasal stuff. So my sinuses are blocked. That's probably the thing that's like, I know what I think that means, but I don't think that's what you meant, so then we sort of go actually work with different kinds of doctors. Because you might go, go to work with a surgeon because that's who you know, and you go, ooh, I don't like this, and oh my God, he's up all night, and I don't want to do that. But there's a whole breadth in medicine. There's family physicians, internal medicine specialists. There's people who do community medicine. So there's pretty much something for everybody in medicine. So you just have to figure out where to go.